Marisol. I am a mother of 2 kids. My youngest will be 4 in a month. And after I had him, I've kind of yo-yoed through my diet. And I've always been small-waisted. At this point in my life, my weight has creeped up in my mid area, which it's really concerned me. So I decided to just go ahead and do the lipo procedure. There's nothing going to be better than to help me, to motivate me to get a healthier lifestyle, targeting the areas that I need to be treated. Good morning, it's Monday the 30th, it's my lipo procedure. I'm very happy. I'm a little nervous, I gotta say, but I know I couldn't be in better hands than Dr. Nowak. Good morning.
Good morning, how are you doing today?
Doing good.
Great, are you excited?
Very.
Okay.
My hands are sweaty.
Your hands. So it's okay to be a little bit nervous. As I tell people, if you're not nervous, it's going to make me nervous, okay? You're going to do just fine. So we'll go through and see if you have any more questions. Then we're going to mark the areas. They'll then take you back and they'll clean and prep the areas, get everything ready, and we'll go ahead and get started.
Sounds good.
Well, I know we've done a lot to prepare you with the pre-op appointments and everything, and it's going to be a great day. Most people find it much more relaxing than they ever expected. It's a combination. We do give you medicine to relax you, and most people don't take the time, don't take a day where they just have people taking care of them, and that's really what it's all about. You're there with us. We'll be there if you need anything throughout the whole procedure, so you'll do great. Alright, so we're going to go ahead and mark the areas here. And so you can see this side, what we can pinch is what we can work to reduce and improve. You can see that this side's a little bigger, a little fuller than this one here, and that's very normal, very natural. We'll do some work down in these areas here. Try to make as few openings as we possibly can, but as many as we need to get you a good result, because that's ultimately what the goal is. And then as we're done with the procedure, we'll be doing the thermage, and that's going to help tighten and reduce the stretch mark. Okay, so we went ahead and marked all the areas, so this is what we're going to be able to achieve in one procedure for you. So as we talked about, we're going to work across the lower abdomen here, we're going to work onto this upper abdomen area here, we're going to work on the waist, and then we're going to come up into that area of the back. Because for you, we don't have to do as much on the lower back, we're actually going to be able to do the outer thigh area for you, and that's going to work great to help recreate your body's proportions and give you a better, slimmer figure.
So here I go.
Good morning. How you doing?
I'm doing good.
Have a seat for me. Are you excited?
Very.
Yay, it's your day.
Okay, we're going to go ahead and get started. So you just lay back and relax. The beauty of it is that you're here with us awake during the entire procedure. So if you need something, you can let us know. If you want a sip of water, you want the little patch for your eyes because you're facing up towards the light, you're going to do great. So we're going to go ahead and start with the numbing process. Just go ahead and lay back and relax. We'll try to keep you as covered as we can. And as we tell people, the numbing is the hard part because you have just a little numbing on the edge. We're going to go ahead and get started there. So you're going to feel a little pressure in the area. Some people will say it's like the skin stretching a little bit. Some people will feel a little sting. How are you doing there?
I'm doing good.
Okay.
I don't feel anything.
Great. You don't feel anything? Great. Yeah, some people feel very little or nothing. And some people will have some areas where you might be a little sensitive for just a moment. And then the numbing medicine kicks in. This is really the hard part there. And this is the hardest thing to explain to people is they think the actual procedure is going to be the hard part, but at that point you're completely numb. So if there's anything that's hard, this is the hard part. So just lay back and relax, you're doing great. And we're using the numbing solution from the little IV bag there, and it just has the numbing medication, which is lidocaine, a little epinephrine to help constrict the blood vessels. It helps the anesthesia last longer, reduces the risk of bruising, and helps it makes it just so much more of a safer procedure because you're totally under local. No general anesthesia, not knocked out or anything.
Very comfortable. I really don't feel much. Maybe a little burning here and there, but nothing bad at all.
On a scale of 1 to 10, what would you say that you're at?
Is that 2?
A 2. Alright, so we're just finishing with the numbing part of the process. How was that, Marisol?
It was a piece of cake. It was comfortable. I was sleeping, dozing off here and there, having conversations with the doctor too. So it was fun. I was excited.
expect a little bit more discomfort and nothing at all.
Because you were telling me that you were expecting it to be more than that, but you really thought it was very easy.
I was afraid I was going to start crying, but I was great. No tears.
So no tears or anything like that. So that's the hard part. So everything's all nice and numb. You get to sit and relax for a couple moments here, and then we will go ahead and start the process there.
Sounds good. Thank you. Now that I'm numb, I feel heavy, and if I touch it, it feels funny. I don't really have a sensation to my belly. So it's going to be good. I'm feeling great. I'm relaxed. I don't feel a thing, and I'm ready to see my new body.
So we're going to start our Smartlipo procedure. This is a little laser fiber. We will put that right into the fat layer right underneath the skin. So there we go. We can see the laser right underneath the skin, so we can see exactly where we're working. We can feel the areas, and we can see that we're working right in that fat layer. It has to wear the little goggles, the little eye shields for safety and protection, but they're very comfortable during the entire procedure here.
Yeah, I don't feel a thing. It feels like a little gentle massage. Feels great.
Yeah, so they feel like a little tapping, a little vibration there as the laser's underneath the skin breaking up those little fat cells for us. We're going to work on that waistline a little bit to give her some better shape and contour there. Alright, so we're going to go ahead and start the procedure. Yay! So that little tapping sound you hear, that's the little machine that's helping us out. The little vibration, the machine moves like 800 times a minute. And some people say it feels a little bit like a massage, and it just goes through to help break up those areas and help remove the fat for us. So you just lay back and relax. You're doing great until it's in. So as you can see, the little power assisted machine is helping us remove the fat from these areas. We've already used the laser to help melt and break up some of the fat in these areas. How are you feeling?
I'm feeling great. I don't feel anything. I'm really relaxed. Having a lollipop, and it's amazing how it's all going in there, out of my body. I'm sleepy, yeah. I feel really comfortable, really relaxed.
Okay, so we're getting ready to start the thermage. So how was the first part? How'd you do?
Piece of cake.
Piece of cake?
Piece of cake. It was relaxing. It was great. There were some areas that were a little catchy, tickles, but it was great. Yeah,
I was surprised you were actually laughing and giggling in some of the areas. And some people with the power assisted machine do feel that, but it's really that easy. Mm-hmm. So you would do it again?
Of course.
Of course. And it looks great. We can already see the shape and contour. Now it's time to tighten the skin. That's what the thermage is. So this little tip here is going to use radio frequency to heat and tighten the skin. So the beauty of it is you're going to be totally comfortable. Okay. Normally with thermage you have to feel some heat. Because we've numbed these areas, you're going to be totally comfortable. So we're going to go ahead and do a thermage pulse there. You feel anything? Great. And that's the way it's going to be. You might feel a little heat on an edge, but overall it's going to be very comfortable. It's going to shrink and tighten those stretch marks, and it's most importantly going to tighten that skin for you. Part of the thermage. You got about 10 pulses left. How was it so far?
It was good. It was great.
Did you feel anything at all?
A little bit of heat, but not bad at all.
Okay.
Tolerable.
So on a scale of 1 to 10, how would you say that was?
About 3.
3? Okay, great.
I love it.
Here, we can already see that the stretch marks are looking tighter. You can already see how she's thinner, has more shape, more contour, and that's only going to get better. So, yeah. All right, so we have the last couple pulses here. After that, they're going to get you wrapped up in the garment and ready to go. You go home, you take it easy, rest and relax this evening, and tomorrow you're up walking and moving. We want you to do like a good 20-minute walk, and then we will see you in the office on Wednesday.
You're all set, ready to go. Are you happy?
Yes, I am. It was a piece of cake. It was Easy. Okay, so I'll see you tomorrow at the seminar.